So most people aren't aware that there can be a very simple reason for the cause of some of their conditions. So I have lots of patients who come in who are I'm a musculoskeletal doc, but they'll come in and say, "Doc, I'm having a hard time sleeping, or I'm having a time shutting my brain down, or so I can't get a good night's rest, or I can't recover well, and I'm trying to get ready for this marathon, or I'm using this special diet because I think I have Crohn's, I think I have irritable bowel." Or why do I get 40 minutes into a ride or 40 minutes into a run and my fingers and my feet burn and tingle? The answer to all of that could be one problem, and that's what's called MTHFR. And that MTHFR just stands for methyl tetrahydrofolate reductase. And this is an enzyme, and it's specifically two enzymes in your liver that are critical for the metabolism of folate. So we need to take whatever you take into your body that has folate in it, green leafy vegetables, meat products, and many other things, that folate needs to be converted to a fully active form. And if it doesn't get converted, then you have a deficit of folate, and a deficit of folate can cause these symptoms. It can cause your tiredness. It can cause your irritableness. It can be the cause of the burning and tingling as you are participate as an athlete when you're running. And so when we have a deficit of folate, it typically causes neurological conditions. And so it can be things within the periphery, the hands and the feet. Neurological could be neurochemical, and this is where you can have sleep deprivation or maybe the anxiety issues that come from that. But a single simple test of this will determine if you have a genetic issue. And what the studies show, it's anywhere between about 50% of the country having a single mutation and about 20% of the country having a double mutation. And so what that means is if you have one of these mutations, your body is not able to give you or create the active form for you, and that starts a deficit. And if you're especially an athlete and you're out there being very active, the demand for folate is very high. And what people don't understand is, oh, it's just folate, that's B9, I can just take that. Well, your body can't convert it, right? If you have these genetic issues, take all the B vitamins you want, especially the full B9, you can't get it. Your body is in a deficit. It's converting only a percentage of that. And you being a highly trained athlete, or being a very active person, or maybe a busy person or a stressed person, you're going to be burning through your B vitamins, and especially that B9, and that starts to create the deficit. And then that starts to create the symptoms. There's many good studies tying this mutation, this MTHFR mutation, to our gut problems, irritable bowel, Crohn's, celiac. Good studies proving that it's a big part of the anxiety issues, depression issues, sleep issues for the neurochemical effect. So I would strongly say, if you're, I have a lot of patients. I've done this for almost 30 years. A lot of patients come in and go, "Well, what do you think about this? And what do you think about this?" And I said, "Hey, let's do the test. Let's get you started on the supplement." And the supplement will tell you. And people come back, "Oh, my burning in my arms went away." I've had many people come back and say, "Hey, I was scheduled for carpal tunnel, but my carpal tunnel pain and neurological pain went away." Right. All that's saying is all of these symptoms are due to this genetic issue and this lack of folate, where your body cannot convert. It's not giving you the right amount, and that deficit is creating symptoms. So the simple answer is go get your MTHFR test done. We have a great lab that you can get that done at iomihealth.com. Order the MTHFR test. We get those results back in days. If that shows positive, then we know the supplementation is going to work and work well for you. And there is a very good possibility that you're going to see good results, and not only good results, quick results, but most importantly, long-term results. People always say, "Well, does it work for everybody?" Of course it does. Of course it does. If you have a deficit and I feel your deficit, then you're going to be better, right? It's about time in terms of how long it takes. Many people can go, "Wow, I'm feeling better within weeks," and other people can say, "Well, it took me 2 months before I started to notice symptoms." But the issue is you're going to see those symptoms go away. You're going to see the GI issues go away. You're going to see the burning and tingling symptoms go away. you're going to see the sleep disturbances go away, because now you're feeling this deficit that your body needs. And folate touches everything. So it's one of the few vitamins in the body that actually goes everywhere and touches every system. And so if you have a deficit, you can have many, many conditions that you're unaware of, that this is the cause. And the doctors are prescribing drugs for this or treatments for this, when really all of it is this genetic issue and this loss of that the right amount of folate. So I would encourage you to get it tested, and then if you're positive, start treating with one of the Iomi formulas. The one we recommend is C3. Lastly, in the world of genetics, so it's 2 genes that we're looking at. And so now the world of genetics is, hey, on this gene, one can be, numbered like 1298, and on this gene, one could be called 667. 667 creates all of these pathologies. 1298 creates all these other pathologies. So as science is improving, you're seeing more and more of these studies going, oh, we're seeing symptoms with people with this mutation, but not that mutation. So it's going to help you differentiate where this is coming from, but you still have the simple solution: get the test, take the supplements, get better.